Hello friends, welcome to the channel of PMT2 and today we are going to record the fourth video of Potentox. Now again let's start with the Potentox. Potentox, as you know, it's a brand of cefepime, amikacin and L-arginine as a resistance breaker, and it's available in a 3 pack 625 milligram, 1.25 gram and 2.5 gram. Now moving forward, what we are going to cover in today's video, that the unique selling points of Potentox. The first USP of a Potentox, it's a synergistic brand. It offers a broad spectrum coverage, combats antimicrobial resistance, offers established safety and efficacy. It is well approved by DCGI, that is Drug Controller General of India, and it is patented in India, USA and other 8 countries. That is, in total 10 countries Potentox is patented. Now let us cover all these top points one by one. The first point is synergistic. Now the synergistic means the 1 plus 1 is equal to more than 2. Okay, so synergistic basically when the combined action of a two molecule is more than the expected one is called as a synergy. Okay, now when it comes to Potentox, here we are showing the synergy of any antibiotic is depicted by the MIC, that is a lower MIC. So here we are comparing the MIC of a plain cefepime, amikacin with Potentox. These are the bacteria. Now this is the, for example, in a Klebsiella pneumoniae is a bacteria. So when the MIC of a Potentox here is 8 to 32 fold reduction in the MIC. Similarly, when it comes to Pseudomonas aeruginosa, there is a 16 fold reduction in the MIC with Potentox when compared with cefepime and amikacin alone. Now another bacteria, that is the Acinetobacter baumannii. Here in case of Potentox there is a 8 to 16 fold reduction in the MIC, and in case of E. coli bacteria there is a 4-fold reduction in the MIC. So this clearly proves that Potentox is a synergistic brand and it works at a lower MIC. Now there is another study which was depicting the which is showing that the cefepime and amikacin is basically synergistic combination. Now this study was published in the IDSA. That IDSA means that is the Infectious Disease Society of America. This is one of the most renowned institution or most renowned body of the America, wherein the title of this study was, that is a quantitative assessment of combination antimicrobial therapy against multi-drug resistant bacteria in murine pneumonia model. So what exactly the objective of this study was according to IDSA? Here in this case the combination assessment of antimicrobial therapy was done against the MDR bacteria, that is a multi-drug resistant bacteria in pneumonia model. Okay. Now these two bacteria here was selected for the study. This AB, here the AB stand for Acinetobacter baumannii and PA stand for Pseudomonas aeruginosa. Now here in this case, the main parameter for the synergy was the interactive index. Okay. Now three types of combinations were used in this study, that cefepime plus amikacin, cefepime plus levofloxacin and amikacin plus levofloxacin. Now here the interactive index is a marker of the synergy. Now if the interactive index is less than 1, it is called synergy. If it is 1, it is called as additive action, and it is more than 1, then it is called as antagonist. Now here in all these three combinations, in case of Acinetobacter baumannii, the interactive index of cefepime and amikacin was just 0.698, which clearly reveals that this combination of cefepime and amikacin is synergistic one. And when it comes to cefepime levofloxacin, of course this is showing to some extent a synergy, but it is near to 1. And where in case of amikacin and levofloxacin combination, it was 0.994 and it is showing additive action. Now the second bacteria, that was the Pseudomonas aeruginosa. Herein again the cefepime amikacin combination, the interactive index was just 0.718, which clearly shows that this is again a synergistic combination, Pseudomonas aeruginosa as well. Whereas in case of cefepime levofloxacin, it is additive, and in case of amikacin and levofloxacin in Pseudomonas bacteria, it was antagonist. So this clearly shows, as per this IDSA, that is the Infectious Disease Society of America, this is a synergistic combination. So the two parameters which is showing that it is a synergistic one, that is a lower MIC, and second was the interactive index, which clearly reveals that Potentox is a synergistic combination. Now coming to the second USP, that is a broad spectrum antibiotic. As we have discussed earlier also, that cefepime works against both gram-positive and gram-negative bacteria, and amikacin works against gram-negative bacteria only. So when we combine both cefepime and amikacin Potentox as a brand, as a product, now cefepime amikacin is offering a broad spectrum coverage, that is covering most of the clinically relevant gram positive and gram negative bacteria. Now the third advantage, the third USP of Potentox is it combats the antimicrobial resistance. The first part, that it offers an enhanced susceptibility. Enhanced susceptibility means enhanced sensitivity, that enhanced activity of the antibiotics. So the better susceptibility means the better bacterial eradication and the better killing of the bacteria. And Potentox is highly effective against aminoglycoside resistant bacteria, and it is of course highly effective against the quinone resistant bacteria with the this product, which is we along with the ARBs, that due to the ARBs, that is antibiotic resistance breaker, which we have incorporated into the Potentox. Secondly, the second benefit is that it prevents a relapse of infection. Now, the relapse of infection is a condition wherein it is basically developed because of the bacterial biofilm. Now, what is bacterial biofilm? Now, the bacterial biofilm is basically a film. It is a biological film which is developed by the bacteria on the indwelling medical devices. When I use the word indwelling medical devices, it means the external medical devices. On the surface of that external medical devices, bacteria produce the biofilm. And in case of when the bacteria produce a biofilm on external devices, like for an example, we talk about catheter, we talk about cannula, endotracheal tubes of the ventilator, and in case of orthopedic cases, in orthopedic surgeons, they use orthopedic rods and pins. On these external medical devices, bacteria produce a film and they attach on these external surfaces, and they produce a biofilm. Now, in this case, most of the antibiotics, they are not able to penetrate this biofilm. So, on maturation, when this biofilm rupture, most of the bacteria which were present in the biofilm, they come out of the this biofilm and they spread into the bodies. Now, this is leading to the relapse of infection. Now, the ARBs, that is the antibiotic resistance breakers, which are present in Potentox, they prevent the formation of this bacterial biofilm. And third one is the maintains hospital bacterial ecology. Now, hospital bacterial ecology basically is a condition wherein in hospital setting, within the hospital environment, the bacteria starts transferring the resistance from one bacteria to another. Now, this is leading to the disturbed hospital bacterial ecology, wherein in the most of the bacteria which are present in the hospital setups, they got resistant because of the resistance genes. Now, Potentox having the antibiotic resistance breaker, they prevent the transfer of resistance from one bacteria to another. This is leading to the maintaining of the hospital bacterial ecology. So this is how the Potentox as a whole, as a brand, is basically combats the challenge of antimicrobial resistance. Now, coming to the enhanced safety and efficacy, here I am sharing with you one of the clinical trial report, wherein the clinical trial report was done. It was comparing the Potentox versus a plain cefepime, and the clinical cure rate with Potentox was 89%, vis-a-vis in cefepime it was just 71%. So this clearly shows that Potentox has a better clinical efficacy when we compare with the plain cefepime. Now, when it comes to the safety part, see, Potentox is available in clinical use since 2009, and till now, 2.75 lakhs patients has been cured successfully with Potentox without any serious adverse effects. So this clearly shows that Potentox is clinically highly efficacious and it is safe also. Now, when it comes to the approval, because we cannot market any product into the Indian market without approval of DCGI. Here the DCGI stands for Drug Controller General of India, and Potentox is well approved by DCGI. Now these are the DCGI approval certificates. This is the DCGI approval certificate for 625 and 1.25 gram, and this is for the 2.5 gram. Now, of course, we are proud to share that Potentox is patented in India and USA also. Now, you can see we are proud to share with you this is a patent certificate of Potentox in USA. This is in India. This is in South Africa. This is in Ukraine, New Zealand. This is in uh, this is in Korea, and this is in Australia, this is in Europe, and this is in Mexico, and this one is in Canada. So this one we got to share that Potentox is well endorsed by the most of the international authorities, and it is patented in India as well as in USA. So with this, we finish up this fourth video of the Potent Talks. I'm really thankful to you for giving a patient sharing, and I will request you to once again to please like our channel, subscribe our channel, and click on the bell icon so that you can get all the notifications once we load the any video on the Potent Talks. Thank you very much.